parking is sometimes evil. Let's check out that.
We'll probably repeat the question anyways, so
Yeah, we'll ask them when it's time for Q&A maybe.
that works.
Okay. It looks like it's 5:47.
Nah, I got it.
Yeah, do we want to maybe close one of the doors?
Yeah. Yeah, let's close one, leave one open for ease of access.
Wheelchairs get the top ones.
Okay.
So we'll be interpreting your presentation. We're just waiting to figure out where to set. So that we're not blocking anyone.
Yeah.
We don't.
Yeah, do we...
If you would like any of us to move so that you have space, that's fine.
Yeah.
This video's only going about to the edge of that board. To the edge of the board.
And I can even, if they all shift in,
Yeah, we could shuffle it
Ah,
a little bit.
condense that a little bit.
Do you want me to move? No.
Maybe leave it.
Yeah.
Yeah,
Okay,
we
cool.
do that.
Okay, I think we're going to get started. I want to welcome all you wonderful people to this session on chronic illness and gender confirmation surgery. My name is Rebecca Hamill. My pronouns are they, them, theirs. I am a 35-year-old agender disability activist, and I will be the moderator for this panel today. Just before we get started, I wanted to go over some group of agreements. I'd like us to all commit to accountability. So when we share with good intent, and we tend to the impact of our words on others. Also, I'd like to say that while our presentation is public, if someone else shares, their story stays here. The learning goes. So take the learning with you, but let's respect each other's confidentiality, unless someone explicitly gives you permission otherwise. Move up, move back, which I think we've all heard, which is it just means share space. If you've been talking a lot, let someone else have a turn. If you haven't spoken yet, I hope you feel comfortable doing so, but if not, totally fine. Finally, when you do share, I'd like you to to state your pronouns and your name, and also to respect each other's pronouns. So with that, I'm going to let our panelists introduce themselves. First, I want to thank Annette for assembling this panel and for inviting me to moderate. So here you go.
Hi, I'm Annette. Identify as male, and my pronouns are he, him, his. I had gender confirmation surgery a little less than a month ago. I have a chronic illness that I have had, well, it's genetic, but I've had progressively since about 4 years ago. I do disability activism in my spare time, and I'm really passionate about this subject, as you will see in the
Hey y'all, I'm Autumn. I'm 19 years old. I use she, her pronouns, and I identify as a girl, sort of. Let's go with that. A little bit of girl, a little bit of meh. I am disabled by a chronic condition. I have, had it my whole life because it's genetic, but it's only really gotten bad in the past year. So I'm a little bit new to chronic illness, though it has affected me throughout the years. I had gender confirming surgery about 2 years ago, and complications because of the illness which I'll go into later, so it's quite relevant. I'm just so excited to be here and that you're all here.
Sorry. My name is Hayden. I use they, them, and he, him pronouns interchangeably, either or. It's really up to you. I'm 20 years old. I had gender affirming surgery summer of 2015, and in 2012 I was diagnosed with von Willebrand's disease, which is a genetic blood clot disorder. That's really all I know about my family history. I was adopted when I was 15 months old, so that was good to know before getting surgery. so I didn't bleed out on the table or anything else like that. I am in college, majoring in psychology, and hopefully getting a PhD in clinical psychology at some point.
Thank you. And just to clarify, I am someone, I think of myself more as the audience for this panel. I'm someone who has not yet had any gender confirmation surgery, but am also interested in learning about it and possibly pursuing it in the future. But, you know, with the knowledge that I also have a chronic illness that will make things complicated. So I'd like to, you know, take some time and just so you know, we'll have a question and answer period afterwards. For people on our panel to really tell their story, like, how your chronic illness and your gender confirmation surgery impacted each other.
So first I want to say that I'm about 7 years out of when I first came out. I was 15 at that time. I'm now 23. And I did not pursue medical transition until about 5 years after I was originally out. And it had to do with a lot of things, but mainly money and family relationships. I first started to look into whether or not I was eligible to have gender confirmation surgery about 2 years ago. Up until that time, I had convinced myself that because I had chronic illness, it just wasn't going to happen for me, and that was okay. Like, I had accepted that, and it was okay. And then I met someone with the same illness as me who had that surgery, albeit before they knew they had that illness. And so I was like, oh, well, maybe I can do this. And also at the time, with the ACA guidelines making it easier to use your insurance to have surgery, I was very optimistic about whether or not I could have surgery. So about a year and a half ago, I had a consultation with a surgeon, and she was very optimistic about that, yes, I could have surgery, and it was fine, it was good. And so I went ahead and scheduled the surgery, and I went into her office, and I had a pre-op, and everything looked great. And then I went to actually have the surgery that day, and that's where things get a little complicated. So I was there at the surgery center. I had all my pre-op stuff, and the anesthesiologist comes in and is asking me all these questions about my medical conditions and everything. And he determined at that time that he was not comfortable performing my surgery. And this was in right before I was supposed to go into the operating room. And so, there was about an hour where we were going back and forth, can we get to be able to do this? Are we going to do this? And ultimately they were like, no, we're not doing this today. We're going to have to reschedule. So I didn't have surgery that day. Then I rescheduled the surgery again. And right before I was supposed to have surgery, I got sepsis. And so I wasn't having surgery. And then third time was the charm. That's when I actually ended up having the surgery. And there weren't as many complications that I had originally anticipated there were going to be, and it was pretty okay. And my surgeon was really, really nice about everything. But because I have a rare disease, there's not a lot of research or anything about what kind of are the complications that would go along with this, and have there been a large amount of people that have had this before. And I'm really grateful that my surgeon felt comfortable performing the surgery, but I'm not sure that any other surgeon would have, especially after the first time. And one of my kind of things about this is that I think a lot of surgeons, especially ones who only do gender confirmation surgery, really want their patients to kind of go through a conveyor belt. You come, you're the same as everybody else, everybody has the same surgery, you go in, you go out, a week later you have your follow-up, and then I'm done with you and I never have to see you again. And I don't want to hear you complain. I don't want to fix anything. I don't want to do a revision. This is just the way that things are. And I really feel like we need, both, mostly for people with chronic illness, but generally more individualized care in the surgery, like kind of community for trans people.
So I came out when I was 15 years old, and I had a lot of family support, and I was very lucky, and so I actually pursued medical treatment very early on. I ended up having surgery when I was 17, gender-confirming surgery. When I was 15 years old, I found out I had von Willebrand's disease, similar to Hayden. It's a blood clotting disorder, and I found it out because I actually did blood work before going on hormones just to make sure everything would pan out. There's a history of clotting in my family. I'm the odd one with bleeding. So I knew I had that going into my surgery when I was 17. I mentioned it to my doctor, who was fairly okay about it. She made a whole lot of comments about it and was like, I'm not super comfortable with this. And I know she definitely required sign off by my hematologist, which is valid. But she was like, don't go telling people I do this. I already had someone else come for it. And so it really seemed like she was very uncomfortable with the idea of operating on someone who wasn't cookie cutter, as Emmett said, like, was something a little different that they actually had to pay attention to and actually, like, use their brain a little bit more. Maybe that's being a little too harsh, but so I went through the surgery, and the actual surgery went all right, but I had a slew of complications that happened afterwards, and that's actually due to a different chronic illness I have called Ehlers-Danlos syndrome that affects my connectivity and stuff, and it affects healing. I didn't heal basically after my surgery, and so the sutures dissolved before anything happened, and I just ran into tons of different complications. I would actually consider my surgery a botched surgery because it didn't really turn out well in the end at all. I don't regret having it, but if I had known about my illness beforehand, that would have been a lot different. I might not have had it at that time, or I might have just been prepared to deal with whatever came my way. So that was definitely a big thing for me. And it would have been really nice for my surgeon to understand that too, because my surgeon kind of blamed me for all of my complications. She was like, oh, it's not healing, it must be your fault. So there needs to definitely be a lot more education about chronic illnesses, and surgeons have to really not think so cookie cutter like everyone's the same, because they're not. I mean, everyone's different, has different needs and different healing rates and different everything, and so that's super important.
I thought like the bottom of the mic was falling out. It's not. So I knew that I had von Willebrand's because my parents and I decided to do a lot of other blood tests because I was like getting nosebleeds a lot, and like that was just kind of a hassle. More than that. And so we found out that I had von Willebrand's disease, and I ended up getting my care at Children's Hospital, and they were really, really great about letting me know that like if I ever had a surgery, we'd have to talk about that treatment plan. And at the time, I wasn't planning on getting any surgeries in any capacity, but I needed my wisdom teeth taken out because I had 3 impacted wisdom teeth, and 1 was just kind of just there as well. So that was kind of like a good test run to make sure that DDAVP, which is also desmopressin, would work for me and would like help my blood clot for a minor surgery such as my wisdom teeth extraction. And that went smoothly, and that was fine, and I'm pretty sure my insurance covered that. Is that correct? Great, thanks. My parents are here. I was like, I don't actually know. So that was really great with my wisdom teeth extraction, but I healed very, very slowly. I was told that if I did not have von Willebrand's disease, I would be able to eat hard foods again in 2 to 3 days. But because I had von Willebrand's, it would take up to 7 days. My mother will tell you a different story, which is that I'm a wimp, but I was not able to eat anything other than very overcooked pasta until 2 weeks after my surgery. So I was concerned with getting gender-affirming surgery about the healing process being very slow, me considering myself having a very low pain tolerance, and kind of just like laying in bed for longer than I would want to. I Don't know what cup size I was for anyone who knows what that means, but I was technically eligible for keyhole for my top surgery procedure, and I did ideally want keyhole because I also just like scar pretty bad, and I was not into the aesthetic of a keloid scar on my body in general. But in the consultation with my surgeon, I was aware of my blood clot disorder, and she had mentioned that I might need to get double incision instead of keyhole so that she would be able to make sure that there wasn't any place in my body where I was bleeding out that she couldn't see, and like halfway through have to change to double incision because that would just also not look that great. It would be better to start out with the intention of double incision. So I was kind of okay with that, and I was still like, I really want keyhole. Don't forget, I really want keyhole. But I was also set on having her as a surgeon, and she said that she felt more comfortable with a double incision procedure rather than a keyhole. And I was like, that's fine, but I still want keyhole, and I still trust you, and I've seen your results of keyhole. She sent me some photos, so that was anyway. But in terms of pre-op, I was able to get my EKG and other things like that. But I was on the phone a lot with my endocrinologist and their office, and they seem to be moving more in the direction of getting me something called Humate-P, which is more expensive than DDAVP, but can be taken in larger doses. And so that seemed fine, and their plan looked good from my non-medical professional eyes and understanding. And my surgeon read over that plan and called my endocrinologist and was kind of like, so how much out of pocket would it cost Hayden and Hayden's family if they have to pay for this thing to have their blood clot? And basically it would have been another $10,000 to $15,000. So we were like, let's look at DDAVP options. So we eventually did, and that, I clotted well and recovered well. But that was kind of a deterrence, and the endocrinologist wasn't aware that we were already paying out of pocket for my $10,000 surgery. And they weren't aware that having my blood clot would be another expense for us in addition to the other post-op care that I would be receiving. So similar to kind of, not similar, linked to what Autumn was saying in terms of being okay with the surgery and how it turned out, I am fine with having double incision because I did know going into the operating room, the pre-op room, that there was a possibility that I would not be getting the ideal keyhole incision that I had been wanting for 4 years before that, but also kind of think that it could have worked because my other surgery went well, and so other things like that. So I kind of wish that my surgeon had been more open about looking at different options and kind of, I don't know, maybe being more open to keyhole or a periareola, but so I don't know, but overall I am fine with my results. I'm not looking to get any revisions, although one of my scars did keloid. So overall for me it went kind of smooth. I will say that that's also probably because my mom is in the medical field and I kind of knew how to talk to people and ask the right questions, and she did as well, and she did great with my post-op care to make sure that I did everything I needed to heal well and for everything to go smoothly. But yeah, it could have gone smoother, but overall I felt that it went pretty well.
I just want to say one thing before we pass the mic back. So both Autumn and Hayden were younger than me when they had surgery, and also they both had parental involvement, which I did not. I'm 23, I had surgery a month ago, and I did not have my parents or any of my family present during my surgery. The only person that was there was my home health aide, and I did not tell them that I was having surgery until the day of, because I was very, very nervous that it wasn't going to happen. So I think, in terms of self-advocacy, it's very different when you have family and friends who are there and talking to your medical professionals for you, versus if you're by yourself, which is what I was.
Yeah, so true. Yeah, so it sounds like you all had a kind of longer road than some people to get the treatment you needed. But so I'd like to ask next, what would you like medical professionals to know about treating trans people with disabilities, especially surgeons who are doing gender confirmation surgeries? So yeah, what would you like surgeons and medical professionals in general to know about treating trans people with chronic illnesses?
I guess that I would like them to know that, yeah, like maybe it's extra work for you and you don't like that. That's not something you enjoy, but you have a responsibility to us as your patients just as much as you have a responsibility to anyone else as your patient. And doing that extra work can make the difference between a good surgery and a bad surgery. I also think that it's important for them to know that we know our bodies best. And so if there's something that I ask you to do or ask you to think about, that it's not because I think I know more than you, it's because I know myself. And so I'm doing what I think is best for me. I also think that, you know, like I said, knowing your body best. When the anesthesiologist came and was like, I don't think this is a good idea, and I was very against that, and I was like, this is fine, it's gonna be fine, like, I'll be fine. It's like they didn't listen to me, so listening to your patients, listening to what they want, what they need, and also just being open to new and different things. I know that's not something that these surgeons encounter a lot, is things that are new, and doctors especially just in general don't like new things. But like, new isn't always bad, and just because I'm not a medical professional doesn't mean I don't know anything.
Adding on to that, I would say to surgeons, like, it's still medically necessary for us to have these surgeries, even if we have a chronic illness or disabled or whatever. Like, we still need them. I mean, they're still important. It's really important not to discount people who don't exactly have a voice for themselves sometimes. As well as the surgeons should really be open to learning, because I mean, things can't stay the same all the time, and like, it's not actually that much more work to learn about what we have, to listen to us, to speak with our doctors, and to figure out what we need so it can be a successful surgery, because just ignoring it won't lead to a successful surgery, and totally not doing the surgery, again, it's medically necessary for us. Like, you can't just turn us away. I mean, this is a sworn oath to do no harm. That's doing harm. So really just listening to us, learning, taking the initiative to actually like take the challenge, because it's not that difficult, and there's a huge community out there who needs this.
Yeah, I kind of don't have much to add after that, but similar to most things, I think it's, yes, patients do, for the most part, know their bodies better than a surgeon who you just met and had an hour-and-a-half consultation with, but also, like, we know that people with disabilities and people with chronic illness are getting gender-affirming surgeries and gender confirmation surgeries. Surgeons should be willing to reach out to their colleagues and say, like, how did this go for you, and what can I do to make sure that I can care for my patients as best as I can, and what can I do in my practice to make sure that my patients are getting taken care of as best as they can, and like, what can I make sure not to do? So kind of that calling in, and then also referring out, I think, is helpful. I am glad that my surgeon was like, if you really want keyhole, you might want to look at someone that's done more keyhole procedures than me. And also at the same time, I was kind of like, no, I'm kind of set on you as a surgeon. So, but again, that was not a huge downside of my procedure and experience. But I think referring out is helpful, and also calling in is helpful, and that's something that people should be doing, and networking is good.
Thanks, that was great. So then from the opposite side of that, I was wondering what kind of advice you would have and what you would want people to know if they have a chronic condition or chronic illness and are seeking a gender-affirming procedure.
Medical records are really important. If you don't have, make sure you have them all. If you can't have them all because there are too many, make sure you have the really important ones. Make sure that all your other like specialists or whatever know that you're having that surgery, and so they can call your surgeon if they have any questions or vice versa. Make a list of questions or notes before you have your consultation. So, like, I mean, everyone should do that, but especially if you have a chronic illness, so that you remember which questions are important to ask. Do your research on your surgeon. So, like, I know that's also important for everyone, but definitely, like, reach out to other people with who maybe if you know if they have a same illness or similar illness to you who have had surgery before, and ask them, like, what surgeon did they use and how was their experience. Also, being really aware that, like, don't, like, letting your surgeon manipulate you or, like, tell you that something that you know that isn't true. And really being you're your own best advocate. And so, like, don't doubt yourself, and don't, like, tell yourself that it's not worth it or anything, because you know yourself best and you're your own best advocate, and if you wanted to do this, there's absolutely no reason why you shouldn't.
So definitely all of that. Also, I just have one thing to add. Make sure you're able to have the surgery, like you personally can take care of yourself afterwards. Make sure you have a support system in place. Make sure, in case any of your conditions or whatever flare up, that you're able to take care of yourself no matter what happens. That is so beyond important, because you can be super dedicated to the surgery, and that's great, and you can have it, but just make sure you can take care of yourself, because there's nothing worse than getting it and then botching it. Like, you can always reschedule, but make sure you're in a place that you are able to take care of yourself post-op. And for some surgeries, that might not be as hard. For some, they might be harder. So, like, just really, really keep in mind if you're going to be able to do it, not just medically on the paper, but, like, the long journey afterwards. And also, I just want to mention this specific question. We made a checklist, or I made a checklist for patients before they see a surgeon and throughout the process, just to kind of keep things in mind, and that's the link up there. I'm sorry if it's a little hard to read. So if you're curious, you can just go to that, and it's just kind of a basic checklist of important things to remember before you seek surgery, when you're speaking to a surgeon, and then actually before surgery. And it can just be helpful because it's easy to forget things. It doesn't have everything. You can personalize it to however you need. You can just go there and download it if you want. It's a Google Doc.
Yeah, I don't have much to add, but before my surgery, I knew that Autumn also had von Willebrand's disease, and I just reached out to her and was like, how did this go? What should I be doing? Like, did DDAVP work for you? And that was really helpful for me. I mean, I was also reaching out to friends that I knew had the same surgeon as me or the same procedure as me, and was kind of like, what do I do? It was like, great, need bendy straws. But in addition to that, also it was helpful to know Autumn with it. I mean, for DDAVP, we have to be on fluid restriction, and I was kind of like, that's confusing. You have to drink a lot of fluid after surgery. So if you have friends that have, again, if you have friends that have had either the same surgeon or the same illness that you do, definitely reach out to them and see what you can do, or if they have any other advice for you.
We had surgery with the same surgeon like a few days apart, especially.
We are intentionally not mentioning who our surgeons were.
Thank you all very much for that. And just one thing to add is that if you are looking for people with who have a similar chronic illness and are interested in gender confirmation surgery, the internet's a really great thing. We made a Facebook group for trans health and my genetic disorder. So when I'm as I'm looking at this procedure, I can actually connect with people who belong to this very, very specific subset of humans. So internet. Does anyone have anything else to add before we open it up to Q&A?
Oh. Okay. We've got a service dog mic complication. She's a little tangled.
The other thing we wanted to mention is that we are live streaming this, and throughout the live stream, the four of us have been in the video, and we have the board in the video. But if we are taking questions at this time, if anyone is uncomfortable with the live stream continuing, please raise your hand and we will stop it. But if not, we will continue the live stream so that friends at home can watch if they are not able to be physically present right now.
It is only focused on us.
So yeah, you can't see your faces or anything like that.
But please feel comfortable to let us know if you're not comfortable. Okay, great. So we'll open up to questions. Please speak as loudly and clearly as you can, because I can't bring this mic over there. Yes, you.
Yeah, I have a quick question.
Yes.
I have not found anything yet if I could have the surgery or not, but I do have the degenerative disc disease.
Mm-hmm.
With that, in C3 to C7, T11, T12, L3, 4, and 5.
Yeah.
Would that be any would that be any obstacle to surgery?
Well, we're not medical
Yeah.
professionals.
But I mean, I'm just curious if.
But
I
I
would
also
say
have
that's-
degenerative disc disease, so let's talk afterwards if you'd like.
Yeah,
I would
sure.
say definitely specific questions like that are good to ask your doctor as well, because they would know best. We aren't offering
I
medical
can be told I'll be
advice.
seeing my doctor on the 31st after this. I wish I
Don't sue
would have
us.
what this stuff was.
Good luck.
Any other questions?
For top surgery, I'm still trying to solve the recovery riddle
Okay.
for those of us that are in chair,
Mm.
use the arms for everything.
Um,
How in the heck do you solve that damn thing?
so I will tell you what I did.
Excellent question.
That's a really, really good question. I will tell you what I did, which was I had someone who was pushing me around for the first 3 or 4 days, and then after that, after the first week, I was exclusively using my power chair. I have a manual chair, which I use sometimes, but I did not use it at all because I couldn't. But also definitely having someone to push you around is a key to that. I had friends who were helping me, and I also had home health aides. But recovery riddle, especially if you live alone, like I do, or if you don't really have family around, is hard. And it would have been hard regardless of whether I had a chronic illness or not. But yeah, for the chair, definitely power is the way to go, and having someone to push you is key.
I would also say, while transportation itself is difficult, I know when you're in a chair, you use your arms for a variety of other things. And so,
Transfers.
yeah, transfers would definitely be difficult. But just reaching objects and stuff, just a simple, one of those claw grabber things can be really handy. To just pick things up so you don't have to lift your arms that far. That could definitely be beneficial.
There and then back there.
I don't know if you guys can answer this, because it might be a very much person-to-person thing, but if you have chronic pain, how much longer do you think it would take to recover from something like top surgery? Because generally I have very bad chest, neck, and back pain, and so if I get top surgery, I'm worried that I'm going to be out for more than the 2 weeks that people say that they are.
So actually, I found the converse during my thing. Because I have chronic pain, I didn't find the surgery as painful as some other people do, because I live with pain. So people who don't have pain are oh my god, this was the most painful thing in my that I've ever had in my entire life, and I'm it's kind of uncomfortable, but not super painful. But I definitely found that dosages of pain medication might be different for you than they are for people who don't have chronic pain. And I would definitely suggest talking to your surgeon about that before you have surgery, and what your pain level currently is, what pain medications are you currently on, and how would that affect your dosages of pain medication after surgery.
Does anyone else have
Yeah, does anyone else have?
I have a quick thing.
Yeah. We'll get back to you.
Sorry. As I mentioned, I talked to a lot of friends before surgery about kind of how it went because I was just very nervous. And I have friends who do not have chronic illness and kind of their recovery was a wild card, so it is really hard to know. I expected my recovery to be a lot longer than it was, and for me to be in a lot more pain than I was, and I also expected to feel very sick from my pain meds, and I didn't. So I would say definitely, again, communicating with your doctor and doctors about that and how other pain meds and other things like that have gone in the past for you.
And this is different surgery, but just remember that recovery times are an estimate, so even the most experienced surgeon doesn't know exactly how long it's going to take you to heal. And, you know, if you've had past procedures, like, you might have a better idea of that, but otherwise just, you know, remember that, like, you know, everything's, you know, an estimate.
Wait, back there and then.
Yes.
Did you actually have anyone turn you away?
So I did not, like I said, the anesthesiologist did turn me away, but the actual surgeon, no, like the first person I went to was like, yeah, but I honestly can't imagine that if I had went to someone, like a different surgeon who maybe was more popular than the one that I had surgery with, or like had more surgery, like does more surgeries, that I might have gotten turned away. Especially because during, like, from the time that I scheduled a surgery to almost a year later when I actually had the surgery, I had deteriorated significantly. And so I don't know if I wonder that if I was in the same state now that I was, if I had been in the same state now then if she would have agreed to do the surgery. Like, for example, before the surgery, I like was eating by mouth, and now I'm almost exclusively tube fed, and I wonder that if a surgeon would be comfortable doing a surgery on someone who's tube fed. Because I had significant like nausea and vomiting after the surgery for like a week. So I don't like I think my surgeon was a little naive, and I'm not sure that if she would agree to do the surgery if she had to.
Does anyone else need to say that? Okay.
My question.
There was someone in the purple shirt. Yeah.
I'm sorry.
Sorry, I wanted to first just say thank you so much for organizing this panel, because it's so hard to find disability and trans spaces like this, and particularly for like youth organizers to be doing this is really cool to see. And then also, I wanted to acknowledge and say I'm sorry for the ways that very often doctors, but particularly in this case, blamed you for different things, or like we're just doctors. And then my actual question was, I'm autistic and have other disabilities and chronic illness and health and stuff, and one thing that I find particularly difficult is that once doctors become more aware of all of those layers, it creates a wider and wider gap of respect, where I become, you know, less intelligent, whatever, it's a horrible system, and all these things, right? And so self-advocacy actually becomes harder, even though those things are necessary for me to explain in order for them to make informed care with me. So I'm just wondering if you have either stories or concrete ideas around self-advocacy for doctors to understand that you are an expert in your own body.
So I actually have something for that, because I definitely experienced that with doctors. Whenever I'm going to someone new or someone who that might happen with, I try to bring as much like scientifically backed evidence, peer review journals, stuff like that, that like really objectively states what my conditions are and like why whatever I want is why I want it. Like, they're just kind of like things that are irrefutable, like studies that they really can't be like, well, no, because like it's scientifically backed or peer reviewed, whatever. I find that to be my largest weapon, basically, that and having another person with me, because it's really easy to be kind of like stamped down on when you're alone, but it's a lot better when you have someone else to fight for you. It's a crappy system that it is like that, but bringing someone with who like really has your back and isn't afraid to say something is super important.
So like, I agree and disagree. I agree like that, like sometimes it's really good to have someone with you, but other times it doesn't, it actually defeats the purpose. I've had doctors, when I brought someone else with me, talk exclusively to them and not to me. And so like, it's like I don't exist. especially if that person, especially being young, and if that person is older than me, like that it's like I don't have, my opinion doesn't count. So I would say, like, especially in terms of like these surgeons, knowing as much as you can about the procedure, and about your medical history, and especially just like about trans stuff in general, and like making sure that you are proving to them that you are actually just as knowledgeable as they are, and also really finding a surgeon who cares. I know that like sounds like kind of hard, but like as the insurance market began to open up to having surgery through insurance, there are actually many more people who perform these kind of surgeries out there than there were before, and you don't have to go to like the one or two that everybody goes to. And so like finding someone compassionate and like being like, you know, and also disclosure is a complicated topic, right? Like you said you're autistic, like you don't necessarily have to tell your surgeon that you're autistic if you don't want to. And I find that like disclosure of things like obviously actual medical things are like you need to disclose them, but like I have depression. Do I tell my doctors that I have depression? Like no, because that would be like detrimental to what I like am trying to accomplish. So I think disclosure is always a complicated, whether it's medically or in a job-based environment or just with friends, but really feeling out like what you think they would react to.
Also tacking onto that, just if you do have any information you have to present, try to do it in a neutral or positive manner and not like look scared and hope that they're not going to say anything, because that's kind of set the tone for it. I mean, it's kind of the same when you're coming out, like set the precedent that this isn't a thing that they should care negatively about. Like it is what it is, and like that kind of sets the tone for everything.
I don't you really all covered it.
Now, you.
Quick jumping back to we had mentioned how managing pain medication might be different with chronic illnesses. Are there any medications that you have taken for your chronic illnesses that I was in surgeons talk earlier, and they were like, oh, there's a list of medications you can't take, and like obviously like T or estrogen you have to be off of around your gender affirming surgeries. But did you at any point have to be off one of the medications you need for managing your illness on a daily basis? And if so, how did you deal with that?
I don't have a direct answer to your question, but something else I forgot to mention is one of the other main reasons that I was originally tested for von Willebrand's was because when I was menstruating, my periods were about 6 to 8 weeks long, and with like a month in between, and that was for me menstruating for 3 years. And because of that, my surgeon did not ask me to go off testosterone for my surgery. So I will say that my surgeon was accommodating in that strain, because they were like, we don't want you bleeding more. And I was like, good idea. So I will say like they were accommodating in that sense, but I apologize for not having a direct answer to your question.
I did have to go off of several medications that contained NSAIDs because you're not allowed to take those before surgery. It was hard, but like I also tried to look into like alternative medications and like discuss with my primary care provider if there were other things that we could do to like mitigate the pain, and it ended up like being like I don't want to say like to do something like this, because I don't think I'm not trying to advocate like illegal activities, but I had hoarded like some old pain medication that I started to take, like some narcotic pain medication that I started to take when I wasn't able to take my regular pain medication, and so like I don't think, like, I'm not advocating that as like a strategy, but like that's what worked for me.
Thank you.
Two things.
but it is a new process for a lot of the medical community as well. And they're learning as well. And it helps for you guys, what you're doing is to teach them. And for example, there are routine discharge instructions for this surgery. And the routine instructions that we got advocated using, what, do you remember what it was? And there was something we luckily asked about it. And they were like, oh, no, 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 you shouldn't do that with von Willebrand's disease. So they don't know, you know, so it's just, it's ongoing and hopefully it will get better.
I will also say I think I would not say that it is our job to tell our surgeons about conditions that are on the books in general and that surgeons should be learning about in medical school, such as transgender health in general, not just transgender surgeries and affirming care, but like how do you treat a trans person and not out them to everyone? And that is not taught in med school. So what my mom is referring to is that on my specific surgeon's post-op care, she suggested taking arnica, not the topical cream, but the little pills that go under your tongue. And a side effect of arnica is bleeding, is nosebleeds. And I was like, we just got away from that. So also, I guess, reading kind of like your post and pre-op care documents. I know they're very long. Sometimes they put them in Comic Sans. I know that it's easy to read, but read your post-op documents, and there's a lot of jargon in there. But for me, that was helpful and kind of like, because it's me, a fun activity. But I would say also to make sure that if something is helpful for your procedure, maybe being like, I don't think I can do this. So checking with that, and I'm not exactly sure how arnica works, but I don't think my pain or recovery was any different from not taking it.
I did take the arnica, and now I'm questioning everything.
Yeah, and just like to the idea of like, you know, what is and isn't our responsibility to teach doctors, like what a doctor should and shouldn't come into this knowing. I mean, a lot of us are, you know, coming into this like already like exhausted from being trans, like, you know, and dealing with that kind of discrimination, like exhausted from dealing with our chronic medical conditions, many of which cause fatigue and then other issues. So, I mean, like, I think it's not too much for us to ask, you know, for the doctor to do some research on their own and to not leave all the teaching to us. But then at the same time, I think that, you know, a doctor who's not willing to do the learning on their own time, like that should put up red flags. Because like, I don't trust me as like a non-medical professional to tell like a surgeon like every single thing that they need to know about this. So, you know, that's just something that I'm thinking about when I'm choosing doctors.
And I apologize if that came off, that I just meant there's so much information to learn.
Oh,
Certainly,
absolutely.
it's not for anybody to go in and be, you know, like telling the doctors what to do, but there's so much to learn.
Seriously, there is a ton to learn.
I would add to that, I don't expect all of our doctors to automatically know everything about us before we even meet with them. Like, I don't expect them to know every single rare illness and disease and whatever out there. Like, that's hard. But and I think this is what you were kind of making the point of, is they should be researching this stuff after they meet us, after they learn about this. Like,
It's all online.
they should take the initiative to speak to our specialists, to look through journals and stuff and really make sure that they can provide the best care for us. That's not our responsibility to tell them all of the cautions of operating on someone like us, because we're not medical professionals.
I am just going to say that we're actually over time.
Oh, no, we're not. We're going till 6:45.
6:40. Oh, there's one. Okay, we have like
9 minutes.
9 minutes left. So I'm going to take we'll take 2 more questions, and I think we're going to wrap it up. Katya, and then.
Fast comment. You guys have talked around it but didn't actually say it. You can always fire your doctors, even if you just don't like them. So there's always, it might not be as convenient, it might not be your first choice. There's always somebody else, and if your surgeon's not doing what you need, or any other doctor, dump them.
I think I'm going to answer that quickly.
Oh, yeah.
Yeah, no, just adding to that, it's even if they are medically doing everything right, but you are uncomfortable with them for whatever reason, get a new doctor. Like, you should be comfortable with your doctor. Totally, you can fire them. You have options.
Okay, over there.
Hi. I don't know how to word my question. I just know what my concern is. I have multiple sclerosis and I have a bunch of symptoms, but my concern is my cognitive decline. So I wanted to know if there's any other people with trans experience, right, that want gender confirming surgery, but do you consider like having a healthcare proxy, or does anyone have a healthcare proxy that might make the decisions for you and know you that and know what kind of surgeries that you want, or maybe could, I don't know if that's making any sense.
No, I get your question. I feel like Rebecca looks like you have an answer.
No.
Oh, no.
I'm trying to
Yeah.
rephrase the question in my mind.
I actually might,
Okay.
because my mom's a health lawyer.
Okay.
So it might be a power of attorney. You might want it written down,
Yes.
the stuff you want done.
They're doing that for free in the community.
Okay?
They're,
So
they're filling them out and stuff. There's an organization that's working in the community room right now, helping with name changes, how to work, I got a will filled out and a power of attorney because I'm in the middle of a wicked divorce. So, and I was like, the last thing I want is for me, hit by a bus and have my ex-wife in charge. So, and the guy was very thorough. It's an organization that's dedicated just to helping our community.
Thank you very much. Community knowledge is always appreciated.
Do you know the name?
Yes, hold on.
Probably Forge.
Transassistance.org.
Can I ask a clarifying question?
Yes.
Not of you, but of the original asker. So when you're talking about like what you want, what you don't want, are you talking about like trans health procedures in the future, or are you talking about like say a living will or a healthcare proxy in case of the unthinkable happening during surgery?
Probably both, or more like gender confirming surgery.
Okay.
So let's say for me, sometimes it's hard for me to communicate.
Mm-hmm.
And it's not because I don't know, it's just that it just doesn't come out.
Oh, I feel you.
And someone that I might explain that to, or like he said, they said like write it down, and that if for some reason I can't verbalize that, that I can still go ahead and fulfill my gender confirming surgeries with my person. Does that make sense?
Yeah, totally.
Just to add to that, you might not need a legal document or proxy helping you with that. You could also, it's up to you. Legal probably carries a lot more weight, but you just have a close friend who understands that and could go with you and kind of explain the situation, and like you could have it written down and signed. If you don't want to go through a whole legal process, that might work too. I don't know, but.
Also, just like going off what Rebecca said, like I think it's important generally if you have a chronic illness to have a living will. In case something happens to you, whether that's during a surgery or just generally, because if you don't have one and something happens to you, basically like your closest relative would make all the decisions. And if you're anything like me and don't really have a great relationship with your family, I really wouldn't want that to happen. So I just think that's an important thing to do. And they always ask you, like I know where I go to the doctor, they always ask me every single time, like, do I have one? And then they like give you information about if you want to make one.
Two things about that. One, Whitman Law for Health was doing legal presentations in the professional session about specifically that, and also advanced directives and things like that. So they did have a table the last 2 days. I don't know if they'll be here tomorrow or if they've already closed down. But they do have stuff on the Google Drive, like the main professional Google Drive. I can give you that information. Additionally, I do a lot of healthcare advocacy. I'm chronically ill myself. I'm a nurse, pain management nurse, And so if anyone wants information or needs help looking up resources to present to the doctors, I would be more than happy to help them find that information. So you can get a hold of me that way too.
Okay, we're gonna have to like wrap up now. It's
Okay,
yeah. But I think we all really want to thank all of you for
Yeah,
coming.
thank you so much for coming and making this,
Yeah.
this happen.
Yeah. And like feel free to like come up to us and like
Yeah, feel free to come up and talk to us. We're here.
Thank you.
And you were smart. I didn't.
Shauna is there? You know Shauna? Okay.
it's fine. I like have other people find it.
That's fine. Do you know where the Shabbat is? Oh, you know what? Wait. I have a link to the group. I think I can find it for you if you want to go.
Yeah. I would like
Yeah, sorry.
Okay. I probably
You wanna
still,
post it
just
and get
as